And we can move on. Question 5. Why is licensure an important practice in the delivery of healthcare? Answer in 2 to 3 paragraphs. Include resources if you want, but provide the citation. So our junior tutor has said that licensure of professionals attempts to raise the standards of services customers receive. The governing body establishes the basic qualifications professionals should meet to obtain a license to practice. Those qualifications include educational and training requirements and demonstration of competence by passing 1 or more exams. The government can revoke the license if there is evidence that services are substandard. A newer argument for licensure is that rent on members of a profession through a barrier to entry will lead them to make additional efforts to provide services in a competent and ethical manner. Penalties from losing the privilege through disciplinary action is quite large. Consequently, hospitals, ambulatory care facilities, and various types of insurers are establishing policies as to which physicians are to be allowed to perform a procedure or be paid for performing a procedure. Medical licensing by states has been common, and the initial license is based on graduation from a medical school accredited by a liaison committee on medical education and allied programs from different accredited medical councils. Over time, a large proportion of physicians have become certified. Hospitals use board certification and other credentials to determine whether a physician will be permitted to practice. The increased supply of physicians has been critical to many of the competitive developments in the market for physician services. So one good example I can think of is this in regards to the rent on members of a profession. Is I know in the field of social work, they need to pay a fee of I think it's about $250 every year in order to remain registered with their union. Sorry, I lost my train of thought here. And what this does, by making them pay to maintain this license every year, is ensures to clients and patients that they are of high ability and certified to be giving them the treatment that they need. Little less so related to this, but also so related to it is the degree you get from university. What you're doing is signaling to employers that you're competent and that you're of high ability. And as a result, they're more tempted to hire you. This is especially important in healthcare because it is so critical, such a critical human need. Obviously, if you're injured or you become sick and you go to the hospital, you want to be sure that whoever it is that's taking care of you is competent and knows what they're doing when they're taking care of you. So a good system that's often put in place is licensing. I don't think I have anything else to add to that. I thought that was a very good description by our junior tutor.